begin with, what was that trigger that made you go ahead and begin all the initiatives to go out there instead of criticizing the administration and criticizing whatever is going on right now, to go out there, put yourself out there and help people?
First of all, thank you so much. I honestly am doing that I'm doing exactly what an aware citizen should do. I can't honestly think of a certain point where it all started, but I recently went through a COVID experience and my mom was hospitalized, and that's when it really hit me. So all of last year was more about monetary support, making videos and spreading the word. But then I realized that, okay, there's a lot more that I can do. I have a certain amount of reach, and right now people are honestly confused. They are anxious, they are panicked. And I should kind of be out there and help them and do whatever groundwork I can. I remember when my mom needed plasma, I had put out a post. And the kind of reach that post had and the number of people that contacted me. But even though, with the influence or, the support that I have in Bombay, it was difficult for me to arrange that plasma for her. And that's when I realized that, okay, if this is this tough for me, how tough would it be for somebody who literally has no support? And this was the thought. And it just started off with me sharing one request. And then I was flooded with so many people calling out for help, and it was me and a couple of influencers that started, because Bombay had literally become quite bad. And now we literally have about 180 volunteers working with us. It's a bit of a pan-India movement. Mm-hmm. There's no system to this. We only have one aim and one goal: reach out to as many people as possible, help as many people as possible.
Are you also a plasma donor? And there are so many myths around it. You've made videos about it, you've been tweeting about it as well. How are you in fact trying to bust those myths?
Again, the power that I have is social media. I want to reach out to as many people, make as many content pieces as possible. I'm going to keep talking about it, and it's really helped. Like we have a sister initiative called Plasma Warrior, and that's been doing really well. We've literally been able to connect donors and patients directly. And we again have a team of volunteers. They kind of vet any kind of eligible donor, anybody who's interested. Our team calls them, we take them through the process, we connect them to a patient. And see, that's what's required right now. Right? People get very scared. They feel like, oh, if I donate plasma, will I lose out on my antibodies? Not really, because it's literally just 10% of what is used, and you can actually donate healthy plasma every 15 days. That works out to be 24 times in a year. It is a 2-hour process, but those 2 hours can literally save somebody's life. And the good part is you're not really losing out on any blood, because the system is such that they kind of pump in the blood again into your body. So they're actually literally only extracting the plasma.
By the time patients get to the an oxygen donor or something like that, it's almost over. How do you help those people?
Listen, we are part of the system, right? So our primary idea was that whatever information we put out should be verified. Now, obviously, it's not 100% because, we aren't professionals. This is something that we just kind of started. It is a citizen-led initiative, and it's only getting better with time. But the idea is that we have volunteers that vet out information, because I get so many leads on social media. There's so many people that are constantly sending me information about this. So I send it off to a team. They vet it out there. I actually have people that are calling all these numbers, the ones that are fake. Again, it's distributed in my circuit. That, hey guys, this is a fake hoax call. If, please let's not contact this person. And then whenever I put in a requirement, or any of the influencers put in a requirement, our volunteers try and give us the most legitimate information possible. But, as you very rightly pointed out, that the problem is that the requirement is very large, and the resources are very less. So the moment something opens up, there are already like 20 people trying to eye it. And rightly so, a patient who's not in contact with me has equal right on that resource as anybody who's in contact with me. But the idea is whoever gets help there, anybody anyone, even if you know one person who needs help, go do it. Now is the time to show compassion. Now is the time to show solidarity with our country, with our community.
Right.
Irrespective of anything, go out there, help people. Obviously, you need to be safe. I don't want anybody to
Yes.
kind of misunderstand me and think that they should break COVID protocol. Not at all. That's the biggest help that you can actually do for your community right now, is that, behave in a COVID appropriate way. But I feel apart from that, if you have financial aid, go help people financially. If you have the time, become a volunteer. If you, whatever resource you have, if you have reach out to more people, whatever resource you have, put it out there.
Right. The other thing that you've been also tackling is hoarding. You're trying to encourage people not to hoard oxygen cylinders, concentrators, BiPAP machines, which are so important right now, and telling people if your work is done or if you have empty cylinders, go out there and return it or pass it on to a needy person.
Yes. And this is more for the privileged classes, Pia, because we are the ones who can actually afford hoarding things. So don't be scared. The biggest thing is, and especially for us, if you're an educated person, you're truly lucky. And that's the sad truth of, whatever situation we are in right now, So collect all knowledge that you can. It's very important for us to know that, okay, if I as an individual start showing symptoms, the first thing I need to do is a test. And if I don't have access to a test, I need to get in touch with a physician and get onto the right method of medication. Whatever is required, because that's literally the game changer between you recovering at home and you going to the hospital. That's what I've understood over how many ever people are spoken. It's all about when you start your medication, and it's very, very important because it is a viral infection and it is going to spread in your body. If you don't take all the necessary steps, you are going to reach a point where you will need hospitalization. And that's the point that we all need to avoid getting to, because our medical sector cannot support it right now.
Bhumi, very honestly, we've had 1 year to tackle something like this. The second wave seems to be even deadlier than the first one. Do you think somewhere our system failed us? We failed the system at some point without, we became also very complacent as citizens to go out there without masks?
Look, I am not an expert. Okay, but from whatever I've observed, and as somebody who is a part of the problem, let me also kind of put it out there, is that we as a society didn't take this seriously. There were weddings and there were parties and there were whatever it was. Look, the economy has to run, right? Like I was shooting. That's very important. You have to work. But if we want all our industries to work, we need to follow COVID. We need to follow the protocol that the government has given. People weren't wearing masks. They just behaved like, COVID is over. And I was actually one of those paranoid people that always was lecturing people that, listen, you cannot do this. Because, you read, you're aware, you have knowledge, you know that, okay, while things are okay in India, there are countries in Europe where a second wave has started and it's not been good, So you kind of know that COVID hasn't disappeared, and definitely we are a part of the problem, and definitely we took it lightly, and I feel we are still taking it lightly. I still speak to friends and they're like, oh my God, things are so bad, and I'm amazed. I'm like, are you living in a bubble? Like, do you not see it? Like, how blinded are you by your privilege? Like, it amazes me.
Right. And lastly, of course, before we let you go, last year, it's very easy to blame celebrities. They're the easiest targets. Last year, a lot of stars were blamed for putting up pictures, working out at home, cooking in the kitchen. And this year, they've been on holidays. And a lot of people have been trolled for that. What are your thoughts on it?
Look, I'll tell you something. Honestly, I rather like not comment on it, because I feel like to each his own. I feel like whatever information or any kind of communication that happens through our conversation, I want it to be as positive as possible. And the only thing I want people to take away from this is that, be safe, be home, wear a mask, go donate your plasma, go help whoever you can, don't hoard. We are in a crisis and we are the ones that have the solution.
Right.
That's all that I want people to kind of take back.
Absolutely. Well, more power to you. You're getting a lot of blessings for this. And, hope we all can help you in all the endeavors that you're trying to, reach out to people and do all the things that you are. Thank you so much for talking to us, Bhumi. Thank you.